welcome to Medical Cases. On today's episode, we have a special guest, the incredible Lisa Lai. As we all know, she was a world famous pianist who won many awards for her talent at the age of 25, up until she was diagnosed with Parkinson's disease. Let's welcome Lisa Lai.
Hi everybody, thanks for having me.
It's a pleasure. We're here to listen to your story today. So, how are you doing today?
I'm fine. I just have a little tremor in my hand.
So, you're 40 years old. We understand that that's quite a young age to have Parkinson's disease.
Yes, it is. Actually, it occurs more in men than it does women, and people in their late and middle ages have it more often. Actually, my Parkinson's may have been passed through family genetics.
So, what type of symptoms do you get with Parkinson's disease?
I have a lot of symptoms, but the most recurring one that I have is tremors in my hands. Sometimes I have anxiety and depression, poor balance, speech and sleeping problems, and sometimes I get these unexplainable pains throughout my body.
So now we have Dr. Wong video camming in her office introducing us to etiology of Parkinson's disease.
Everybody, my name is Dr. Stephanie Wong, and today I'm here to explain what Parkinson's disease is. Parkinson's disease is a chronic and progressive disorder of the brain, which means it will worsen as time passes by. And there's no real cure for Parkinson's disease. Parkinson's disease is caused by the malfunction of brain cells called neurons. In our brain, there is this section called the substantia nigra. Let me show you guys. Right here. And in our substantia nigra, there's the neurons I was talking about at first. And the neurons produce chemical messengers called dopamine. The dopamine would then travel from the substantia nigra to the basal ganglia. The basal ganglia is a part of the brain which controls our motors. So without dopamine in the basal ganglia, we would be moving non-stop. So basically, dopamine is like a brake to our muscles when we don't need to move. When there's a malfunction in these neurons, they produce less dopamine. Lower levels of dopamine would then be associated with Parkinson's disease. Though we aren't really sure why there's a malfunction in these neurons, some believe that it might be due to Lewy bodies. I won't explain what Lewy body is, but if you guys would like more information about Lewy bodies, Parkinson's disease, or any other medical stuff, please feel free to contact me. Thank you.
Thank you, Dr. Wong. Now that we understand a little bit more on Parkinson's, does it affect your piano playing?
There are times when I have difficulty playing, but that is only really rarely.
So do you play like before?
Of course, I'm never going to be able to play like I used to before I was diagnosed with Parkinson's, even with the treatments.
So many viewers submitted the same question. How exactly do you treat Parkinson's? Well, luckily I know a pharmacist named Marissa Poe who will explain the treatments and cures for Parkinson's.
Hello, I'm Marissa Poe, and I'm a pharmacist at UCSF. Today I will talk about the types of treatments patients get with Parkinson's disease. So the most common pill that patients get is, I have a list here of a few. The most popular is the carbidopa-levodopa pill. What it does is that when you take it, it converts into more dopamine for your brain. Since people with Parkinson's disease lose dopamine, so they need more. So other medications include dopamine agonists, MAO-B inhibitors, and catechol-O methyltransferase. And they all assist in helping with dopamine. There are also other treatments, such as speech and physical therapy, since patients with Parkinson's disease have troubles with their speech and their body movements, so it helps out. And there's also surgical therapies, which is deep brain stimulation, which helps out with tremors. Exercise and rest is also very good. That's it for today. Thank you.
Thank you, Marissa. Now, Let's discuss what type of treatments you take.
I am currently taking the carbidopa-levodopa pill, which helps me overcome like my stiffness and moving difficulty. I also take MAOB inhibitors, and I am about to get a deep brain stimulation, which will help me with my tremors. And I also make sure that I get enough exercise and sleep daily. And as for therapy, I'm currently looking for a physical therapist.
Oh, nice. I studied physical therapy before I became a host. Okay, let's stand up. Come on. So, aerobic and learning-based exercises are neuroprotective, so exercises as simple as paced walking, dancing, and even stepping over obstacles are really beneficial to a person with Parkinson's disease. So, marching with big arms like this, like sports, like swimming, is also found to be beneficial.
Oh, okay. So this activity that we're going to do is not only going to be beneficial for me, but for others as well, like the people who are watching at home who have Parkinson's disease.
Yes, so let's try them. Right after this commercial break, we're going to have a game right up for you guys.
Ever experienced tremors in your hands? Do you have an unexplainable stiffness? Is balancing a problem for you? Well, if you have all of these things, you may have Parkinson's disease like 10 million others. When it comes to Parkinson's disease, you may think that some prescriptions like amantadine may help your situation. That's why you should ask your doctor about carbidopa-levodopa. Unlike other treatments for Parkinson's, carbidopa-levodopa is a pill the blood can absorb in the small intestine. It travels through the blood to the brain, where it is converted into dopamine and stored in the neurons of the brain until the body needs it for movement. You can notice the changes in your body and how you feel in just 4 to 5 hours. Carbidopa-levodopa is not for people who are allergic to any ingredient in the pill, who are taking reserpine or tetrabenazine, who have narrow-angle glaucoma, and who has taken a monoamine oxidase inhibitor within the last 2 weeks. Some common side effects are nausea, vomiting, appetite loss, lightheadedness, lowered blood pressure, confusion, and dyskinesia. Some uncommon side effects are sleepiness and impulse control disorders such as gambling, shopping, or increased sexual behavior. If you have severe side effects, please seek medical attention right away by calling the local emergency room or the call center, or the number on your screen. Get your Parkinson's treated today. Ask your doctor if carbidopa-levodopa is right for you.
Now we're at the park for some physical therapy. So we've designed a game that includes 3 obstacles. The first obstacle is called stepping stones. In this obstacle, you're supposed to step over the objects in your path in order to help your leg muscles. The second obstacle, you're supposed to step onto small pieces of paper while balancing. This helps patients with Parkinson's disease achieve balance that they will need to use in their everyday lives. In this last obstacle, you're supposed to pick up the water bottle and toss it overhead to help with your arm muscles. At the end of the obstacle, the person who has the fastest time is the winner. Lisa, are you ready?
Should I go on the other side?
Ready, set, go! You can do it! Come on, keep going! Go it! Good job! My turn! Until next time on Medical Cases. She was a talent. I can't even read that. She was a world. It goes like.
Hi, Mark. Thanks for having me.
Hello, my name is. Oh, shoot.
Wait,
Oh, you've been taking it?
Oh my. Someone turn and look back.
it's mine.